This is very interesting. So a patient comes in, hasn't had his dry weight reassessed, even though it was obvious he lost weight. During dialysis, he lost his blood pressure. It dropped. He became hypotensive. The nurse decides to remove more fluid. And when the nurse did this, the blood pressure went up. Why did this happen? Well, I preach about dry weight a lot. What happened is this patient lost actual weight, lost muscle, lost fat, whatever. The patient's dry weight was here, then it dropped to this level. But treatment after treatment after treatment, they never reassessed his target weight. They kept him at this level. So if he was 82, but he dropped to 80, they kept him at 82. So he comes in at 83, they bring him to 82. Comes in at 82.5, they bring him to 82. So he's constantly fluid overloaded. And what happens with fluid? Well, you might think, oh, it went to his ankles. Oh, it went to his lungs. That doesn't always happen. Sometimes fluid can collect internally, especially in an area called the pericardial space, which is the space around the heart. So, nurses, you should know where I'm going with this. Pericardial effusion. Nurses, you should know pericardial effusion can cause hypotension because of cardiac tamponade. Basically, fluid surrounded this person's heart and it restricted the heart's ability to pump and fill and pump and fill because it was too much pressure. So this pressure caused the blood pressure to drop because the heart's barely doing its job. And because that blood pressure dropped, the nurse was like, hey, what the hell is going on? You know what? This patient did lose a lot of weight. I know this patient did. I bet they have fluid around the heart. So the heart's preload was reduced, the heart stroke volume was reduced, and that led to hypotension. That's a nursing thing. So what did the nurse do? Ultrafiltration. That's what she did. She removed extra fluid beyond his set dry weight. So his dry weight was here, even though it should be here. And she went beyond this and removed extra fluid. And she relieved that pressure on the heart, allowing it to feel better and pump more effectively, raising that blood pressure, improving his symptoms. Even though the textbook may say low blood pressure, raise those legs, stop that UF. This is why we're nurses. We need to do critical thinking. This is why we passed that silly little NCLEX licensing test that we had to take. We can't just look at a textbook and follow what the textbook says. Think critically. Did you listen to his heart sounds? Was it muffled? Was there JVD? Was the jugular vein distended? It was their heart rate going like crazy. Did you notice that he looked slimmer than usual? All these assessments were key in this nurse realizing she needed to remove more fluid.